Welcome. I'm Melinda Hereford. I'm here with Dr. Keith Grote. Hello, Dr. Grote.
I
You know, we have worked together professionally and had some really amazing times together. And one of the things that impressed me most, Keith, was your body of knowledge that you use in helping people, helping your patients feel safe so that they can move forward on treatment. And so one of those bodies of knowledge is the 5 Toltec agreements. And I think I'd love for you to share one of your patient, a real example where some of that Toltec agreement was operational, some of your skill base was there.
Gotcha. Yeah, I'd be happy to. It's really been a powerful tool for me. And so I had a patient, Sandra, I'll call her, who had lots of big restorations and had lost a tooth, her lower right second molar, to a vertical root fracture. Clenches her teeth, grinds her teeth. And she had a similar tooth on the left side, number 18, that we wanted to work on so that she didn't lose the tooth. She was someone who's really committed to her dental health. Unfortunately, when we were working on her with the rubber dam on, she had full anesthesia, we thought, but she was feeling it, and we kept trying to get through it. And at some point, rubber dam came off and she sat bolt upright and just said, "This is effed." And she used the full word. And this F bomb was just hanging over the room like a huge thundercloud. My assistant was backing up with eyes big like this, like, "What are we going to do, Dr. Grote?" And the old me, when I was 10 years out of school, would have gone into a technical explanation about how we have accessory nerves on lower molars, and you can have lip and chin signs, but the tooth itself might be still sensitive in some places, and that I was going to give her some anesthetic around the tooth, and the facial nerve number 7 was going to be blocked, and all this stuff. And I don't think that would have been effective. And after having worked with some of these techniques and incorporated them over the years, I was able to just sit back and kind of let that wash over and not react. I responded. And what I did was I waited a little bit and let her say that. And then I just said, "You're right." Yes. And, that helped her feel validated and heard. I think eventually I went into some explanations about what was happening, and we were able to get back in, do some more anesthetic, get the procedure done. But the really powerful thing was in that moment of that extreme tension and her upsetness, if you want to call it that.
Sure.
I was able to just go, "Yeah," and not rise up, because if I took it personally, then I get defensive and then I go into explanation technical mode, and she doesn't want to hear that. And so, ultimately, the crown went fine and she still has that tooth, but it really strengthened our relationship going forward. And she's still been a patient of the practice and has probably referred some people. But it changed our dynamic, it's being able to not take that personally, validate her, and then, address whatever the proximal things were.
So yeah, I think there was a lot going on in that conversation. I mean, I think there's a lot of these, the 5 agreements, the be impeccable with your word, which is you standing really in your own word about what was going to get her to health, not taking anything personally, not making an assumption that you actually knew what was going on with her. I mean, you were definitely doing your best and being skeptical, but learning. So, when somebody has a reaction like that, we go into defense mode for sure, right? We're scared. It's like, oh my gosh, what am I going to do? And that's this muscle of not taking things personally. I think it's a big thing in dentistry, this, like, I was fine until I got here, right? That whole thing about
the tooth wasn't hurt till you touched it.
Exactly.
Now what are you doing? And right.
That's it. And so this muscle of not taking things personally, I know you have worked on that, but it's this was key in turning that communication around and making the woman feel like you really care, and her safety was what was important to you.
Right.
And man, that's irreplaceable.
Yeah. Well, and it helps you stay out of the fight or flight, the survival mode,
For sure.
you want to respond and not react. And so,
Yeah.
to me, this has been really helpful. It's almost like they're questioning what you're doing this for. And we know we're doing it for good things. And if they think we're harming them, then, that starts to go, well, but I'm doing it for the right reasons. And, that's not the place to be. The place to be is say, "Yeah, you're right."
That's it.
We can work on this together.
Yeah. then you're having a heart-to-heart connection. So beautiful, beautiful use of a body of language, or body of knowledge that can help make it go easier with patients, so you can have them be healthy.